So thank you so much for giving me an opportunity to talk about INTACT study. This is a phase 3 trial of concurrent chemoradiation with or without atezolizumab for localized muscle-invasive bladder cancer. We presented the safety update on first 73 patients. I'm the overall study PI with my collaborators from Jason Efsasio and Seth Lerner. This is a NCTN-sponsored trial being designed and run through the collaboration of all cooperative groups here in the U.S., including NRG, SWOG, Alliance, ECOG, and it's in part being funded by Genentech. This is, in fact, one of the key studies which may move the needle in the space of localized muscle-invasive bladder cancer forward. As we know that bladder preservation is now becoming more and more important as more and more patients are asking for it. It's a life-changing event for patients losing their bladder, and they have to get used to a new way of living. And now, bladder preservation is Category 1 recommendation by NCCN for patients who are declining radical cystectomy or are not surgical candidates. And so there was always a need to improve upon the results of chemoradiation, and it became logical to combine immunotherapy with concurrent chemoradiation as the data of combination strategy started emerging in other tumor types. And so this trial was designed, it's a large phase 3 registration trial, looking at enrolling around 432 patients. These patients will stage T2 to T4. These are lymph node negative, metastases negative, so T2, T4, N0, M0 patients. These patients will be stratified based on the chemotherapy regimen of the physician choice, radiation field of the physician choice, performance status of the patient, and clinical stage. These patients will be randomized in 1:1 fashion. It's an unblinded study, so half the patients will receive trimodality therapy, and the other half will receive trimodality therapy in combination with atezolizumab for 9 infusions, which will start at the start of the trimodality therapy and will continue up to the 6 months. The endpoints on this study are very novel. For a registration trial, the endpoint is not overall survival. After conversations among the investigators and FDA, it was decided that this trial, because the question is novel in the sense that we want to see if a patient can preserve their bladder. So we have to have a component as part of the endpoint if the patient's bladder is intact, because patients may lose their bladder for toxicity. And so an event-free survival was designed as a primary outcome for this study. So the events which are part of that BIEFS include muscle-invasive bladder cancer recurrence, regional pelvic soft tissue nodal recurrences, and distant metastases, patient getting radical cystectomy for recurrent cancer or for toxicity, and any cause of death during or after the treatment. And so this composite endpoint of BIEFS is now the primary endpoint, and the secondary endpoint obviously include overall survival, clinical response, disease-specific survival, metastases-free survival, non-muscle invasive bladder cancer occurrences, cystectomy rates, and global quality of life questionnaires. There's an extensive translational medicine component going in this study, which are going to look at different markers like MRE11, DNA damage repair mutations, immune markers, whole genome sequencing. We are also looking at true culture for assessing immune response in these patients. So this trial, which started April 19th of 2019, is now up into 1.5 years, and we have now enrolled 130 patients, which is remarkable for US because the biggest previous trial took 7 years to enroll over 100 patients in the US. So it is remarkable, and it shows the interest of the patients to go on to this trial. This abstract, which we presented in the ASCO GU, was mandated by NCI because this trial was not preceded by a phase 1 or phase 2 study. And so we had to build in a safety check at first 80 patients. And so once the first 80 patients were enrolled, we had data on 73 patients who had received their protocol-specific treatment at the time of submission of the abstract. So this abstract included data on those 73 patients, of which 36 patients had received chemoradiation, which is trimodality therapy alone, and 37 patients had received trimodality therapy with atezolizumab. We were happy to report that there were no grade 3 or higher colitis reported on the atezolizumab arm. If we look back into the data from other contemporary trials in bladder preservation, if you look at BC 2001 or we look at RTOG 0712, these trials have reported close to 10% patients having grade 3 or higher GI toxicity. A recent trial which was just published from Canada looking at combining immunotherapy and radiation in bladder cancer reported high GI toxicity. But in our first 80 patients, we actually didn't report any patient having grade 3 or higher colitis. So that's very encouraging. We reported 7 patients having grade 3 UTI on the atezolizumab arm versus no patients on the standard therapy arm getting UTI. One of the patients developed radiation cystitis, which was diagnosed after finishing immunotherapy, and no steroids were given. So the treating investigator labeled it as a non-immune related side effect, more likely a radiation-induced cystitis. And if we look at the other trials in the previous trials in this space, the GU toxicity is close to 25-30%. And so we were not surprised by these events. However, we did see a lot more heme toxicity. 23 patients experienced grade 3 heme toxicity in the atezo arm versus 11 patients in the non-atezo arm. Obviously, this update was not built in with statistics, so we cannot analyze statistically how significant that difference is, but something we'll be watching as we enroll more patients. None of the patients were given steroids, so it was not immune related, but clearly could be explained by radiation of the pelvis in these old men or women who are getting radiation for their bladder cancer. So based on this data, the DSMC gave us a green light to move forward to continue with the enrollment on this trial, which is now enrolling, I would say, pretty well, despite challenges faced by COVID pandemic, with the support of over 34 institutions which all over US who have opened this trial. And we are very appreciative of their contribution and patients' families and patients to participate in this trial.